Good afternoon, everyone, and I hope you had a wonderful lunch break. Now, obviously, you're aware there are concurrent sessions happening at the moment, so some of our audience has, I think, dissipated, or they're dissipated. We're a little all over the place, but in a good way. So glad this is being recorded so you can catch the wonderful Lisa as well if you're in the other room. But I just want to say the next three speakers are wonderful. High calibre and exceptional content is about to be before us. So without any further ado, I might just introduce Lisa formally. I'm just waiting for Lucy to come in. I can see her, but you know what? I'm just going to get going. So here we go. So our next speaker is Lisa Todd, a registered nurse from Epilepsy Action Australia. Lisa has an extensive nursing background in neuroscience and intensive care nursing and has developed online courses and resources for epilepsy, mental health and medical cannabis. Her most recent activity in the medical cannabis sector related to patient experiences and affordability of prescribed cannabinoid-based medicines. Please welcome Lisa. Her presentation today is titled Epilepsy, Cannabis Stigma and the Impact on Aussie Families. Welcome.
Let's get down, let's get down.
Good afternoon, everyone. Did you all have a nice lunch? Can I just ask, with a show of hands, how many of you are from Queensland? All good roll up. And interstate? Okay, about 50-50. How many of you are from rural and remote areas? Oh, just a few of you. And the rest metro, I'm assuming? Show of hands? Okay. Because it's really important to know where you're coming from, because the context of where you're working makes a huge difference to how people are perceiving medicinal cannabis and treating their patients. It's estimated that there are about 800,000 people in Australia who will develop epilepsy over their lifetime. 250,000 children, young people and adults are currently living with epilepsy, and 30 to 35% of them will actually have drug-resistant epilepsy, and that's a really significant portion. Epilepsy can actually affect anyone at any time in their life, doesn't matter their age, gender, culture or level of intelligence or background. Oh, do you know what? I forgot to move my slides. You have to point at anything? Oh, you have to press hard enough. Okay, and about 60% of people with epilepsy never find out what the root cause of their epilepsy is. Usually it's a genetic, and that's what they're finding out. Okay, so in 2014, it was really interesting because we actually found that there were a lot of consumers. There was a groundswell of consumers who were coming to us and asking about medicinal cannabis. They'd actually seen things on the internet and through Facebook and other social media channels, and we were starting to get questions. At that point in time, we had a fact sheet on on cannabis and how dangerous it was and that it provoked seizures. And it wasn't until we started getting our clients and consumers coming up to us and asking us questions and saying, I tried it and my seizures stopped, or when I was smoking it and suddenly decided to give it up, my seizures came back. And so we thought there's something in this. So we actually stepped back and actually withdrew the fact sheet that we had, and we actually started to look into it and to seek credible information. So we got taught often by our clients who were doing the experimenting themselves. In 2015, we sought to understand our consumers' needs, and through the Australian nationwide survey on the experience and opinions of medical cannabis in people with epilepsy. Now, I was really disappointed because we only got 1,200 people respond to that in 10 days. But when we actually told the guys at Sydney Uni, they nearly fell off their chairs. So they took this survey that we'd put together and they actually did the analysis and wrote up the paper for it. And the survey revealed 14% of the participants had a history of medical cannabis use to treat their seizure activity, which was very similar to other health conditions in research that they'd done. And this was at a time when there wasn't any regulated or prescribed medicine available. And so the main reason for trying the cannabis was to treat resistant epilepsy, was to actually treat their medication-resistant epilepsy and to get a more favourable side effect profile, because some of the anti-epileptic medications have quite terrible side effects, and people are often withdrawing from those anti-epileptic medications because they can't tolerate those side effects. Okay. So there were many concerns expressed by the participants of the study, and those were that they were worried about the illegal status, that they didn't want to be caught with it. We had families where they had been threatened to have their children removed because they unfortunately had disclosed to a therapist or to a kindergarten teacher who had reported them, even though they were having fantastic results and they were commenting on it. They were worried about the unknown content of the medicinal cannabis that they were giving. They didn't know whether it was contaminated, they didn't know how it was grown, they didn't know how the medicine was extracted. They had no idea, and they didn't even know to actually ask those questions. They actually had some of our clients actually had worsening of seizures. So Professor Yuri Kramer, who runs the Israeli paediatric program for medicinal cannabis, he actually stated that about 10% of children with epilepsy, in his experience, will become seizure-free and be on monotherapy. The other 10% at the other end will actually have their seizures worsened and need to be withdrawn off it. But also, in the middle, the 80%, half of those will have a 50% reduction in their seizures, and 40% will actually not have any impact on their seizures, but because it would actually improve the quality of their life, their parents didn't want to actually remove the medicinal cannabis. And so he said that says a lot. So he actually never forced any families off it. We actually did a follow-up and actually did the Pelican study. From the first study, we found that there were 14%, or it was 13% of families had children with taking medicinal cannabis, and it was illicit products. Sometimes it was nutraceuticals that they were bringing in from overseas. And they actually had a look at the, analysed the content of that medicinal cannabis. And the main thing that came out was that with the medicinal cannabis, about the CBD levels were really low, but just about every sample had THC in it, and it was quite opposite to what the families expected. With those families, all of them actually maintained that they actually had a positive impact on the seizures, but when they actually had a look at the cannabinoids in that particular, those particular samples, they found that there were 4 other cannabinoids other than CBD that had a stronger impact on seizures. Okay, so I've actually got a number of families that I've been working with, and sorry, just turn this over. I'm sorry, I've just lost my place. So, with Anita's story. Anita is a 32-year-old young lady who I've known since she was about 15. She was diagnosed with epilepsy at the age of 2, and she has actually experienced enacted stigma as a result of her seeking medicinal cannabis. What she'd actually did was actually go, she lives in a rural country as you can see, and she actually went to her local GP. So her mother actually narrated the story for this particular case study. And Anita was sitting there as well. And what was happening was that they actually decided that they wanted to try medicinal cannabis. They did the research, they formulated their questions, and then they spoke to a few people in town, and they heard that other people had actually tried to approach the local GP, and there was only one at the time, and he'd actually told them that, you know, it didn't work and he wasn't interested. But that wasn't going to stop them. So when they did approach him and they had a lot of questions, he actually turned around and said, "It doesn't work, and just go away, I just don't want to know about it." So they do have a regular change of doctors in their particular country town, and they went to the second one and got the same answer, that there wasn't enough evidence and that they didn't believe in it. Quite a few months later, there was yet another doctor who came to town, and they actually went up to the doctor, and she was actually really interested. She had people, she was from overseas, she actually had families that she knew of who had been using medicinal cannabis with good result, and she was interested. However, the problem was that she was in a practice that was so busy she didn't have time to breathe, and it was 3 to 4 weeks wait to get an appointment with her. And she showed Joanna and Anita all of the paperwork that was required and said, "I just simply don't have the time." And then they actually came to our organisation to actually seek some help, because they actually wanted to try medicinal cannabis, because Anita had tried just about every anti-epileptic drug at maximum doses in multiple combinations, and she still didn't have any effect. And she was having 1 to 2 tonic-clonic seizures a day. So that's a lot of seizures to be having. And she was getting multiple injuries as a result of that, splitting a head and splitting a lip and things like that. So the other thing was that we put them in contact with a medicinal cannabis company. We gave them a list of names and said, "Ring some of these," and they did that. And they actually approached their GP, and this particular company preferred to work with the regular doctor, which was really good, especially with complex epilepsy. And what they actually did was they managed to get her on to medicinal cannabis with the support of that local GP who had an interest in it. And she was really pleased because she was actually learning as they were going along and doing the monitoring. Anita actually then became seizure-free. Over the first 2 weeks, her seizures actually reduced, and then she had a period of 5 weeks of seizure freedom until she actually got an infection with high fevers, and she had an episode of status epilepticus and was transferred to the hospital. So don't forget, she was on prescribed medicinal cannabis, and by this point she was on monotherapy because they'd weaned off a lot of her anti-epileptic medications, and she was using it as monotherapy. When she got to the hospital, the staff in the emergency department didn't want to know about it, and they filled her full of IV phenytoin, which she always gets a lot of nausea from, and also it takes a long time to get out of her system, and as her mother said, she walks around like a zombie for days to weeks at a time, and she still has seizures on it. However, when the mum actually challenged the medical staff, even though it was prescribed, they still wouldn't actually administer it in the hospital. So Anita's mother had to go at 9 o'clock every night and administer the dose and take the medication home with her. So she was transporting it to the hospital, administering it, and they lived more than 20 minutes from the hospital. And so that was the only way she could get it. When Anita got discharged, they went for the post-discharge appointment with the neurologist, and the neurologist wasn't aware that Anita had been put on to medicinal cannabis, and he actually stated that if she chose to continue to take medicinal cannabis, he didn't want to treat her in his practice. So they actually approached another neurologist in another country town who said, you know, we'll treat you, except we know nothing about it. I think you need to see someone else. And that's when they rang us again. And we actually put them in contact with a neurologist, an epileptologist who's really good. And she actually is an authorised prescriber and is in both a public hospital and also in a private practice. So they had that choice of going public or private because we didn't know about the affordability aspect. And at the time, it was during COVID lockdown, of course, and this particular neurologist put the family in contact with another neurologist who was doing video telehealth and an authorised prescriber as well. And they managed to change her onto another product that they preferred to prescribe, and the seizure started to diminish, and then she had a 2-week period of seizure freedom. And also what happened was that with that seizure freedom, she was actually sleeping at night because she was having nocturnal seizures as well. And with that came in urinary incontinence and all of that embarrassment that goes along with that. So she was having a great improvement in her quality of life. And what actually happened was that she ended up having another 2-week period of seizure freedom, and then COVID struck. And as soon as she got COVID with the fevers, she started having seizures again. And that was only about 4 weeks ago, so she's still in the recovery phase. But her seizures now, even though she's only having 1 or 2 tonic-clonic seizures a day, they're much shorter. Instead of being 8 to 10 minutes, they're actually down to 1 to 2, seconds, and 20 seconds and 30 seconds. And Mum is really pleased with that because she said it's a lot more manageable and the post-ictal period isn't as long. It was interesting to hear that her mother, because they live in a country town and it's a fairly small community where everybody knows everybody else's business. And when Anita would go to the pub with the family for a family meal or things like that, people in the community, both friends and people that she knew from school, when it came up in conversation, she always got this comment that, oh, she's going to be high as a kite now, I suppose. And, her mother said, it's just not possible, she's on CBD. But they kept getting these kind of snide and smart remarks, and the stigma that, it got to the point where she didn't want to go to the pub and socialise. And so Anita's mum and Anita have taken the opportunity when these comments come up to try and educate people, because they believe it's a lack of knowledge and a lack of understanding is what's driving these comments, and trying to change that attitude so others in the community will actually speak out and say that they'll actually use medicinal cannabis. Okay. So Justin, who's speaking in the next room, who is a brilliant presenter, and if you get the opportunity to see any of his presentations, you should. He actually had a paper published this year on Should I Inhale? Perceptions, barriers and drivers for medicinal cannabis use against Australian women with primary dysmenorrhea. And so it was really important that there were aspects about stigma in there. And with stigma, let me just find the page. With stigma, it's not a foreign concept amongst people with chronic healthcare conditions, and also where they have, long-term disabilities. Stigma is just a continued issue for them. But stigma can be theoretically conceptualised into many compartments, and there's a wide range of labels that have been used in the literature, such as anticipatory stigma, perception or felt stigma, enacted stigma, through to cultural, systemic or organisational stigma. With felt stigma, It's the internalisation of those feelings of shame and humiliation, just to name a few. Whereas enacted stigma is an external stigma where the behaviour and action of others, such as being avoided, treated less seriously or discriminated against, have ignited a sense of shame or embarrassment. The perpetrators of enacted stigma can come from any walk in life. The degree of impact can vary based upon the context, the relationship with the person, and the value the individual places on the enactor's opinion, and subsequent human behaviours of amplifying the stigma by publicly naming and shaming an individual. Despite increasing cannabis use worldwide and more liberal policies and attitudes, cannabis users are considered to be a stigmatised group. Patients using cannabis for medicinal purposes report experiencing stigma despite the fact that the medical cannabis is legalised, and even those in Australia have reported a sense of anticipatory stigma when they first seek prescribed medicinal cannabis. And it's not so much that the doctors are saying no, it's how it's being said to them. And that's where a lot of the issue is. And it's that person-to-person interaction. And if it's actually just professional and basis, they don't consider that stigma. But when they actually have the doctor or the nurse or any other healthcare professional then go on and give their opinion about what they think about medicinal cannabis, and that's where that stigma is generated from. I was lucky enough to be allowed into a really private international kind of social media group where there were parents of children who had disabilities, who actually had a range of chronic health conditions and epilepsy, and the parents exchanged a lot of information. It was about different treatments, it was about different equipment that they could be using, seizure monitors and aids, and also medicinal cannabis. There were some highly experienced and qualified parents within that particular group, and it was a relatively small group. And they became the go-to people because they had experience and also they had that scientific knowledge. And so when there were questions about drug-to-drug interactions and safety and side effects, because these were the concerns of the parents with medicinal cannabis and interacting with their child's other medications such as anti-epileptics. And also many of them were unwilling to actually disclose to their doctor that their child was on medicinal cannabis. So some of them were using illicit product and some of them were using prescribed product. But there was an environment of fear amongst the group, and it was established when they were sharing experiences of disclosing to healthcare workers or a friend, and the fear of being reported to children's services and the risk of having their children taken away from them. And there are a few cases that have actually been in the media since 2016, 17 and 18, and they were quite high profile cases. And because that spread through the community, there's a stigma attached to actually using medicinal cannabis because of the fear of what's going to happen. It's happening a lot less because there are more pathways to actually access legal medicinal cannabis. For children under the age of 18, there are a number of programs where they get, very cheap or free access to medicinal cannabis from some particular companies. But also, in adults, they can actually, if they can afford it, they can actually get medicinal cannabis, and that price is actually coming down. But it's still a barrier because, especially for people with epilepsy, they need about 10 times the dose that a person with pain or chronic pain would need. So it is well and truly outside the affordability for those particular people. But because of that sense of fear and the stigma of using medicinal cannabis for their children, it was within the group, it was just a given that all of that exchange of knowledge would stay within that trusted group because they didn't want to actually put anybody at risk. And most people actually knew who each other were, but they would be very protective of each other. In Justin's study, they actually had people who were actually feeling the stigma, and they actually were concerned about disclosing to their workmates, and feeling that it may change their perception of them as a person. And then there was another lady who actually was worried about, not about work, but actually about the people that she worked with in the community, because she thought they'd look upon her medicinal cannabis use unfavourably. In this next paper, my paper's all in the order. In this particular next paper, it was actually looking at nurse leaders' experiences and attitudes to medicinal cannabis. Now, in the United States, in different states, they have different regulations, and also that they've got federal funding for many of the hospitals. In those hospitals where they have federal funding, they actually have policies that medicinal cannabis cannot be administered to patients even though they're well established on the medication and they hold a state licence. In Australia, that's a little bit different. In the early days, it was a really big issue because it was illicit cannabis that was being provided to the families. So in one of the nurses groups that I'm in, for the epilepsy nurses, we had a show of hands, and many of the nurses were saying at that point in time it was about a 50-50 split between prescribed and also unprescribed medicinal cannabis. And what they were actually doing is, in some hospitals they were saying, we want to know about it, we're going to write it in the notes, we need to know for drug-to-drug interactions, and we'll actually monitor it, but they couldn't actually administer it. In other places, it was absolutely banned, and they actually weren't allowed to have it on the premises of the hospital, and it was not to be administered. Then some people, even though that was the case there, some people were actually saying, and this is doctors, and there's video of it, where they were saying to the person, it's actually, you know, we're not allowed to administer it, but if I don't know that you're administering it, you know, I don't know. And so families were actually doing it behind their back. So it was making a big difference in how they were being treated. Now, as nurses, it's really, really important, like Linda said this morning, that it's really important that nurses become very knowledgeable so they can have those conversations with the patients about the education. It's really, really important that we actually start learning about it so that we can actually change our practices and change policy. And policy always takes a long time to catch up with practice. But you know, because most of the medicinal cannabis is prescribed, it makes a big difference. So I have one family where their child actually went into hospital and it was actually a prescribed product, but because of the way it was going to be administered, because it was through a vaporizer, the hospital wouldn't actually allow them to use a vaporizer in the hospital because they believed that using a vaporizer, it would actually affect other patients. So they had no idea how the vape was being used, and they didn't have any concept about why he needed to have it that particular way. So there are still issues going on, and it's just a lack of knowledge and a lack of education, and it makes a huge difference. So we did a stream of surveys, Senate inquiry submissions, medical bodies, health researchers are all calling, and even today you've heard it from many of the presenters, that nurses and doctors need to have more education on medicinal cannabis, and also to increase the number of prescribers. The number of prescribers has actually grown significantly since we first started. So I remember when there were very few or none at all, and now, you know, there's over 450. Also, with the increasing scientific knowledge and understanding of the prescribing, the TGA have streamlined the process significantly. The first patient, it took 16 months for them to get their approval and their medication in their hand. Now you can actually have the approval done in 1 day. I've seen it as quick as 2 hours, and you can have the medication in their hands by the next day from some of the presenters. from some of the pharmacists. And it's really, really important that you're aware of what's actually going on, because nurses actually are trusted and they're at the bedside, and they need to have that knowledge, because that knowledge and education will actually remove stigma. Many of you are probably too young to remember when the word cancer used to be whispered. Oh, he's got cancer. And now people talk about it all the time. And that's what we need to happen with medicinal cannabis. Thank you.
So much, Lisa. That was fantastic. So actually, I didn't even it's interesting when you think about cancer. It was once stigmatized, so it does make you realize. But thank you for bringing to life your presentation with such engaging examples as well of what's going on in the community. Really appreciate it. Ladies and gentlemen, please congratulate Lisa on a fantastic presentation. Thank you. I just went next door to listen to Justin, and he is amazing, but I couldn't understand anything he said. So there you go. I was much happier being here.